School may be out for the summer, but I have a pop quiz for the American people following this at home. The following statements are about President Trump's so-called big, beautiful bill. Try to guess whether a Senate Democrat or a Senate Republican made the following statement. Statement number one: if we don't watch out, people are going to get hurt. People are going to be upset. It's going to be the number one thing on the nightly news all over the place. Statement two, reference to the big, beautiful bill. I'm concerned if there are cutbacks in some of the Medicaid programs, it could have an adverse effect on our rural hospitals. Many of them are barely making it now financially. Statement number three, on the subject of slashing Medicaid payments. This is a whole new system that is going to defund rural hospitals. If you guessed that all three statements were made by Senate Republicans about the Republican reconciliation bill, you're right. Even my Republican colleagues know that under Trump's plan, billionaires will win and American families will lose. The more we learn about this bill, the worse it looks. Perhaps that's why the Senate Republican leader is anxious to pass the bill before the arbitrary 4th of July deadline. It is expensive. Yesterday, the Joint Committee on Taxation estimated that the Republican proposal will add $4.2 trillion to our national debt. In Trump's first term, in that 4-year period of time, he added more money to the debt of the United States than any president in 4 years in history. Now he's going to top that number with this new big, beautiful bill, adding to our national debt. And does the proposal borrow against the future in order to lift millions of children out of poverty or invest in clean energy jobs for the future that will grow the economy? Think again. This bill provides tax breaks to the ultra-wealthy. One of my colleagues did a calculation here. If you make a cutoff point of an income of $400,000 a year and say that we won't give any of the new Trump tax breaks to people making more than $400,000 a year, you eliminate 60% of this tax proposal. 60% of it goes to people making over $400,000 a year. What about at the highest levels, 0.1% income? The tax break, permanent tax cut, annually is nearly $350,000. Come on. Do you really believe Elon Musk is waiting to see this, whether this goes through, so he can take this tax break and spend it on something worthwhile? Not at all. The richest people in the United States, God bless them, don't need this tax cut. Working families do. And it's unpopular. A recent Fox News poll, did I say Fox? Fox News poll found that 38% of registered voters supported the House-passed bill. 59% opposed it. And it's downright mean. This measure would be the most significant health care cut in American history. 16 million Americans would lose their health insurance. I heard one Republican senator on the news say, well, that's just health insurance that we're providing for illegal aliens. He's wrong. The Medicaid doesn't cover them. Medicaid people who would be denied coverage, 16 million of them are American citizens. Medicaid cuts will lead to higher copays, longer emergency room wait times, and skyrocketing nursing home expenses. So many of our senior citizens in my state and other places are in places to take care of them. They need a helping hand, a nursing facility and the like. The majority of that is being paid for by Medicaid, and the Republicans want to cut that Medicaid reimbursement. What's that going to do when you're trying to take care of your mom or your grandmother if you can't afford to keep them in a good place? In an extreme situation, they may have to move in with you and change your own lifestyle and your own relationship within your family. One provision in particular in the Republican bill will cripple the funding mechanism used to keep hospitals afloat. According to Children's Hospital Association, this provision in the Republican bill will cut funding for most children's hospitals by 42%. So do you have a children's hospital in your town, in your state? 42%. Ask them what that will mean in terms of services for kids in your home. Take Children's Mercy. It's the Children's Hospital in Kansas City, serving kids in Missouri and Kansas. 35% of its revenue is from Medicaid, and the hospital operates with a 5% margin. If you take a chainsaw to Medicaid, families with 6 kids who trust Children's Mercy will have another worry on their minds. And in red and blue states, rural hospitals will be in jeopardy of closing. For what? For a tax cut for the wealthiest people in America? Really? Don't take it from me. I recently spoke with the CEO of BJC Health, the largest hospital system in Missouri, and a third of their patients are from Illinois, I might add. I asked about their concern with people losing insurance under this Republican bill. This is BJC out of St. Louis, Missouri. BJC Healthcare cares for more Medicaid patients than any other health organization in the region. More than a third of their patients are covered by Medicaid, paying 1 million visits a year. It's the same story for SSM Health, headquartered in St. Louis, operating 9 hospitals in Missouri, including the famous hospital Cardinal Glennon Children's Hospital. SSM CEO expressed her, quote, deep concerns about the proposed Medicaid changes in the Republican bill, stating that the Republican bill, quote, threatens coverage for millions of people and jeopardizes financial stability of safety net providers like SSM Health. For what? For a tax cut for the wealthiest people in America? 60% of this tax cut goes to people making over $400,000 a year. And at the highest levels, $346,000 annual cut in taxes for the richest people in America so that we can cut back on these hospitals. In Missouri, 250,000 individuals are expected to lose coverage under the Republican plan, resulting in Missouri hospitals facing an increase of $430 million in uncompensated care costs in a single year. I know these numbers are numbing. There's so many of them, and they're so big. But let's get down to the basic message. Hospitals that are hanging on, rural hospitals, hospitals in the inner city, children's hospitals, are the ones that are making it barely each and every year. They're the ones who will lose replacement of funds by Medicaid under the Republican plan. What would the cuts mean for rural hospitals in Missouri? Already 10 rural hospitals are in jeopardy of closing. This Republican bill could be the final straw, and I hear exactly the same message across the river in Illinois. I heard this message from Unity Point Health, which has hospitals in Illinois and in Iowa. They told me that Medicaid covers nearly 40% of the children born at their hospital, and they rely on provider taxes to offer maternal, emergency, and behavioral health services. If Republicans have their way, these critical services are in jeopardy and some will go away. Todd Patterson, the CEO of Washington County Hospital in Iowa, said, quote, Medicaid is not a line item, it is a cornerstone. When policymakers in Washington slash Medicaid funding, they're turning off the oxygen for rural health care. I will tell you, I've grown up in downstate Illinois and I've represented it in Congress and the Senate. These hospitals are critical to the economy of these communities. You take the hospital out of a community, you've taken the major employer and a major economic factor. Try to attract a new business and explain the hospital is 2 hours away. Try to keep a new business in town when the hospital is going down. Currently, 107,000 people in Iowa are projected to lose health insurance under this plan. It would increase annual uncompensated care costs for hospitals by nearly $190 million. Republicans in Iowa and Missouri get sick and rely on their hospital just like Democrats. My colleagues know these Medicaid cuts would be devastating, and no Band-Aid hospital grant fund that Republicans are frantically trying to create will make up for this seismic hole. While President Trump said he would protect Medicaid, he is now pressuring Republicans to make deep cuts in the program. He's asking Republicans to choose billionaires over hardworking American families. Now is the real test for Senate Republicans. Mr. President, I can remember when it occurred during Trump's first term. Another tax bill, another massive increase in the national debt. How were they ever going to pay for it? Well, there was a proposal that cut back on the Affordable Care Act, Obamacare, and that cutback was hanging by one vote in the balance. I was sitting here at this chair and watched as John McCain came through that set of doors at 2 o'clock in the morning. He was the deciding vote. John McCain walked to the well and gave a no and saved the Affordable Care Act from Trump's first term. Now we're going through this scenario again. Another Trump tax cut, more cuts when it comes to medical care, particularly for families who are the most vulnerable. Will anyone rise to the occasion as John McCain did? We need 4 Republicans to stand up and say enough. Stop penalizing the families of America and the rural hospitals of America and the small town hospitals of America for a tax break for wealthy people. We're better than that in America. It's time we need 4 Republicans with good sense to step up before it's too late. I yield the floor.